Amalgam fillings, we know that they're constantly leaking bad components to your body, and your body is constantly trying to detoxify from these heavy metals. How is your body dealing with that mercury? Fluoride is one of the 12 industrial chemicals that can harm brain development. The application of fluoride, it is proven to reduce cavities, but at what long-term systemic cost? We can't use fluoride as a magic pill. We still need to take care of. I'm Dr. Maria Floro, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Welcome to this episode of Mind Your Mouth. I'm actually quite excited to share this episode with you today because we're going to touch on the most controversial subjects in dentistry, I can even say in the medical field nowadays. One of them, it's root canals. The other one is the topic of fluoride. And the third one is mercury in your mouth. So how is mercury behaving in your mouth? So stay to the end and let's get started. So when we talk about root canals, when do we need a root canal? A root canal is needed when a tooth has had either a trauma or an infection, a bacteria that has gone from the top of the tooth or from the side and gone from the harder structure to the softer, to actually the nerve and the blood vessels. Once this area is affected, bacteria travel really fast to the roots and from the roots to the bone, and voila, the other parts of the body. Why there is such a big topic, such a big conversation about root canal treated teeth? Because we know that when we treat this bacteria, we are actually removing the soft part of the tooth and filling with different types of material. So it depends on the dentist, depends on who's doing the root canal treatment. Different approaches can be taken. I think what brought this conversation really to the highlights and to the scene was a documentary called Root Cause. It was actually on Netflix. It became a widely spoken topic. What we need to understand is a lot of that research, a lot of the research that we see and that people that are not from the dental field talking about root canals, the research was done back in the day, back in the 1920s and then the 1980s. We have a lot of research too. But what we see is that, like medicine in general, like imaging, like all fields in the health science, we see that things have been evolving, and things that we didn't know back in the 1920s, we know nowadays. So when you ask me, Maria, is it really that a root canal treated tooth is a tooth that's dead, that's left in your mouth? Well, I wouldn't put it that way, but in fact, yes, it is. So, and what's the consequence of this? The consequence can be that, one, you're keeping a nice tooth and you have a function. The tooth is really well done, well treated. And in the practice where I'm at, we treat these teeth with ozone therapy, and we can treat these teeth with laser. And that's an option nowadays. So discuss this option with your dentist. How is the root canal being done? And what material is going to be placed when sealing those empty areas where the nerve has been removed? That's a very important thing. One thing that I really strongly recommend all my patients and new patients that I see that come to me with root canal treated teeth, sometimes they come because we are a holistic practice and they want to have that root canal treated teeth removed. There are a lot of things that we need to look into before making that decision. I'm not going to condemn all root canal treated teeth. What we want to do is actually do some investigation. What's happening with the person's overall health and what's happening with that tooth. So nowadays we can use tomographies. What is it? Tomography. Tomography is when we actually take, it's like an X-ray of the tooth. So imagine that you are looking at me here on this podcast. You're looking at me and you can see me. You can see that there is a wall behind me, but you don't know how my hair is looking at the back. You don't know what's happening between myself and that wall. That's when we take an X-ray. When we do a tomography, what we see is every detail. You can actually look at me. You can see what's happening inside me here. inside there, the space that's in between my chair and the wall, we see a lot of details. And that helps us really diagnose a lot of things. And one of them, when it comes to root canals, is there any silent infection there? Because sometimes we don't feel anything, but the tooth is actually infected. So what we see is that if the tooth is infected, yes, we need to have this conversation. What are we doing now? Are we going to retreat this tooth, or are we going to remove it and have something replacing this tooth? When it comes to this, I want to say I'm removing a dead body. Yes, that's right. But what am I putting in? I'm still putting a dead object. So I'm not, the implant is great. I really recommend implants. I have family members with implants. If I ever needed, I would consider an implant for myself. But what we need to know is that it's still a foreign body, and it's still something that it's not vital. It doesn't have any life in it. So think about it. Don't be radical with your decision. If you are someone with a root canal treated tooth, or if you have a partner, a mother, a father, someone that you care about that has a root canal treated tooth, don't make a radical decision, but make an informed decision. So that's the point that I want to leave in this conversation. I know it's a very controversial topic, and I see a lot of people in the biological and holistic world that I'm part of talking about radical moves towards root canal treated teeth, but I don't think it's a sustainable solution when we look at it, and especially when we look at what we're doing for replacing those teeth. Now, let's talk about fluoride. Okay, I'm going to give you a little bit of an understanding of what fluoride is and why it's such a big conversation. So fluoride is classified as a neurotoxin in several studies. It is found in nature, but it's a very reactive element, and it can't stand by itself. It really needs to engage with other elements, so like calcium and magnesium. When it comes to the application of fluoride and why we have fluoride in water and in a lot of dental products, it is proven to reduce cavities, but at what long-term systemic cost? Safe alternatives exist nowadays, and we are more educated about diet and the frequency of eating, the importance of vitamin D, C in our immune response and how we heal. So it is very important to consider, do I still need fluoride, or do I still need to recommend fluoride to my patient? I think this is a very important thing that we should be thinking about when we make the decision. Am I going to keep fluoride in my water? Am I going to use fluoride on my toothpaste? So fluorine is a highly reactive element, so reactive that you wouldn't find it by itself in nature. It's usually combined with other elements like calcium and magnesium, as I just mentioned. Now, when fluoride gains an extra electron, it becomes fluoride. This negative ion is found in water and in some manufactured items, especially the dental products. But here's is what I find very interesting. Fluoride isn't actually essential to our bodies. It isn't essential to our health or even to our oral health. It's not essential at all, and we need to understand this. Yes, we can find fluoride in nature, for example, on areas where there's been volcanic activity or streams close to volcanoes, rivers, as well as small quantities on food that has been grown on areas where we have fluoridated water. And yes, we do measure those on some fruits and some vegetables that are grown on those regions. But what is interesting is that fluoride in water was first introduced about the 1940s with the purpose to improve dental health. However, in 1944, the Journal of the American Dental Association published an article that was not supportive of the use of fluoride because of its potential risks to health. And what we see later on, around the 1970s, is that fluoride toothpaste and dental products were released to the public. Researchers have pointed out some serious concerns about fluoride. In 2014, two doctors, one from Harvard University, the other one from the School of Medicine of Mount Sinai, identified the fluoride is one of the 12 industrial chemicals that can harm brain development, causing neurotoxicity, especially in kids, potentially causing a drop in IQ in children and cognitive problems in adults. Looking at this research, it really made me wonder about the incidence of patients that we see with lower IQ, of people that we see with cognitive problems. And I'm not sure about you, I'm just sharing my personal experience with this. I never heard my mom talking about a great-grandmother who had Alzheimer's. Maybe we didn't know how to diagnose back then, but was it really that? Or is what we're doing nowadays to ourselves that's really changing our environment? And I'm not just talking about fluoride here. A lot of other things come to place when we talk about this. Other studies show the negative effect of high levels of fluoride on thyroid function. So not just the brain, but the thyroid also feels the impact of fluoride. And again, because fluoride attaches to other elements in the body. The bad news doesn't stop there. Studies have shown that fluoride can disrupt proteins, throw off the balance of important minerals, and even disrupt how our cells work, sometimes leading to cell death. And an extensive review study also highlighted troubling effects of fluoride on behavior and immune response based on animal studies. When it comes to the health of our teeth, yes, it is right to say that a lot of the research indicate that teeth can get stronger in the presence of fluoride. So if this is the way you want to go, one key part to pay attention is that we need to take care of all other factors as well as the fluoride that we're using. And what I mean about that, we can't use fluoride as a magic pill. We still need to take care of diet, hygiene, hydration, mouth breathing, and other things that play a big role when it comes to overall health and oral health. So refer back to our other episodes and we talk a little bit more about how to prevent oral disease and how to help your body keep better health. One important thing, and this is the key of this conversation, if you want to use fluoride either in your water or on your dental products, what's really important is to make sure that you understand that what causes the detrimental effects is actually the quantity of the fluoride, because our body is going to learn to deal with certain amounts, but we want to make sure that we're not overloading our body on fluoride. So read the research and inform yourself. What we do, we know that here in Australia, not all cities have fluoride in the water. And I have recently checked and studied my council. What is my council doing when it comes to the levels of fluoride in my area? Do the same in your area. It's as simple as going on the internet and asking Google or getting in touch with your local council and checking what are the quantities of fluoride that are being added to your local water supply. What some studies have recommended as ideal to avoid negative side effects is 0.7 parts per million. So have that number in your head and go and check for yourself. But the size of the person in terms of body weight is also really important, and it adds a key part when it comes to the effects of fluoride in the body. And that's why kids are so susceptible to these negative effects of fluoride. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. A publication was made on the International Journal of Environmental Research and Public Health in 2019, stating that autism rates have been rising over the past few decades. And while we know that both genetics and environmental factors play a role, one possible environmental link that's often overlooked is fluoride. That's the same fluoride found in drinking water and dental products. Some researchers believe that long-term exposure to fluoride might affect the brain health in ways similar to what we see in autism, like problems with metabolic issues, stress in the brain, and inflammation. This effect could be even stronger when fluoride interacts with aluminium, another common element in our environment. What's especially concerning is that this combined effect might happen even at low levels. Some countries with higher fluoride exposure also report higher autism rates. The takeaway here, these researchers suggest we take a closer look at reducing everyday exposure to fluoride and aluminium as a way to potentially help prevent autism. To sum it up, while fluoride is all around us, it's not a necessary part of a healthy diet or a healthy lifestyle. It can actually do some harm. But on the other hand, it can actually be good for teeth. So remember that when we look at the studies of what's happening in the mouth, if we take a tooth outside of the mouth and put it on a lab and immerse it in fluoride, we see, to an extent, depending on the quantity and concentration, we see stronger enamel. But we really need to see the quantities and we need to see how much we're exposing ourselves to it. And most importantly, and that's the goal of Mind Your Mouth, is to actually help you make educated decisions about your health. I don't want to convince you and persuade you to do one way or another, but I want to educate you in making better decisions for your health and for the health of the people that you love as well. Now, this topic, maybe for the older generations or for someone who's watching, you could send this to your mom, your dad, or your grandparents, someone who you know have silver fillings or those metal fillings in the mouth. Amalgam fillings, it's what they are called, and they have more than 50% of mercury in their composition, mixed with lead, mixed with copper, mixed with other alloys, but we know that they leak. What happens is that I learned at uni that once we place amalgam fillings, they're stable. But in fact, we see cameras that actually measure, and you can look this up on the internet. We see cameras that measure how much vapor is coming out of a tooth when it's under an elevated temperature, which happens all the time in our mouth. Just by chewing, having a cup of coffee, a cup of tea, we elevate the temperature. And yes, mercury leaks. How is your body dealing with that mercury? What happens with that? We know that mercury has an affinity with certain cells in our body, which include fat cells, but also nerve cells. And it's a very important discussion to have. A lot of people that I talk to, and especially some dentists, they claim that not touching those fillings is actually the best thing, is to leave them where they are. But in fact, we know that they're constantly leaking bad components to your body, and your body is constantly trying to detoxify from these heavy metals. We know the research nowadays that shows how heavy metal toxicity affects overall health, affects the brain, and a lot of the endocrine system as well. One thing that we see, and I'm really happy about, is in Europe, they have actually banned amalgam fillings. We see a lot of other countries that still support the placement of amalgam fillings. And what we know is that the research has actually supported so much the knowledge that we have nowadays on the detrimental effects of mercury and heavy metals in the body, that Europe has actually banned the use of amalgam. So this is a win for us. So what we really need to think is, if we decide to have these fillings removed for whatever reason, we need to make sure we follow some safe protocols for the removal of mercury. And what we do, we follow a very strict protocol, not just to protect our patients, but to protect ourselves and the environment during the removal of those fillings. It's very important that we isolate well, that we guide our patients on doing some detoxification, and seeing sometimes another health professional who could help them detoxify. Do some infrared saunas or some saunas to help your body release those heavy metals. There are a lot of protocols that can be followed. So what happens on what we're doing in the dental chair? We are taking a comprehensive approach before we actually start drilling away those fillings. We really want to protect and minimize that exposure to you. So if you want to know more about it, do your own research, write on the comments, and we can talk more about this on another episode. Thank you for watching. It's been great to have you here with us. Share this episode. Make sure you subscribe and follow us, and make a comment. What is it that you took away from this episode that's really going to be useful in your life? Or if there's someone that you love, that you think that this is good information, you could send this to them. Let us know how we can help you and how we can help improve the health of the people that we love and our own health. So see you in the next episode. Thank you for watching. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.